Today is April 3rd, 2009. My name is Ann Halter. I'm an Assistant District Attorney with the 2nd Judicial District, and I'm here at the offices of Alwyn Coyle, that's K-O-I-L, to conduct a pretrial interview in the case of State v. Christopher Martins. Dr. Coyle, if you could state your name, and then I'll have Ms. Hawk state her name as well.
Sure. Alwyn Coyle.
And
Sharon Hawk, in-house counsel for Aptars Pediatrics.
And my intention is to conduct this interview and then provide a copy of the recording to defense counsel in the case, since no one has appeared on their behalf. Dr. Coyle, could I start by just asking you to tell me a little bit about your medical education?
Sure. I graduated in 2000 from medical school at Loma Linda University in Southern California, and completed a 3-year residency program here at the University of New Mexico at the Health Sciences Center here, Department of Pediatrics. Finished a pediatric residency there in 2003.
And are you licensed to practice medicine in New Mexico?
In Mexico, yes.
And do you have any board certifications at this time?
Yes, in general pediatrics.
And when did you become certified?
In 2005.
And what has been your employment since you finished your residency?
I worked at what used to be Loveless Health Systems. Went through a number of changes in the last few years. After I finished residency from August of 03 to April of 06, and started working at After Hours Pediatrics since April of 06.
Is that what the name of this practice is?
Yes.
And what kind of patients do you see?
I see general pediatric patients, ranging from preterm babies to 18 years old, for well checks as well as illnesses.
And did you at one point have a patient in your care named Ethan Garcia?
Yes.
And how did you become his pediatrician?
Actually from birth, I had known a family member and their kids, and Ethan's parents were referred to me through a family member.
And what was the first time that you saw Ethan?
I saw him at Loveless, which I don't have the records for here from there, but I remember seeing him 3 or 4 days of age. It must have been shortly after birth, after discharge from the nursery.
Was he at the hospital?
No, I saw him in the clinic after discharge from the hospital.
Do you know whether he received medical care from any other provider besides yourself during the course of his life?
You know, he surely has come in to see some colleagues of mine when I was maybe out of the office for illnesses, and maybe a well check here and there. But for the most part, I've been his primary care pediatrician.
And as his primary care pediatrician, would you have access to and review records that were generated by another physician in your practice if the child came and saw that physician?
Sure, yes.
And have you had an opportunity to review Ethan's chart?
His chart, it's here in our practice since I've been here, but I do not have his chart from Loveless.
And are those his birth records?
Right.
Is there anything in your chart that indicates problems with the child that might show up in Loveless records?
Probably the child that might show up in Loveless records.
So, something that would be in his birth records that would not have carried over into your records?
No. In fact, most of his records are here, actually, because I think the only records that would be at Loveless were his initial newborn visit and his 2-week visit, because I started seeing him here since 2 months of age, actually. Does that answer your question?
Yeah, pretty much. But I'll have a follow-up to that that's a little more specific. So did you see him 3 to 4 days after his discharge from the hospital or not?
From memory, yes.
Okay, but
Yeah.
that's not reflected in your records?
I don't have his Loveless records here.
You're going to need to help me out here. Were you practicing at Loveless when you first saw him?
Yes.
Okay, so that's why the record of that visit would be at
Right.
Loveless.
Right.
All right. I'm catching on now. Thank you. So when he was 2 months old was the first time you saw him at this practice?
Correct.
All right.
Correct.
His date of birth being?
2/24 of 06.
Okay.
And the first time I saw him here was 4/14 of 06. Actually had a sick visit appointment at that time, and then saw him for his 2-month checkup a week later.
Now, do you remember anything about concerns that the child might be anemic?
Let's see. No concerns of that. Sometimes what happens is that the WIC program, the Women, Infant, Children's program, which he may have been a part of, often checks for that and may have had a concern with that. But there's nothing in my records that I was concerned about with anemia or that was conveyed to me as a concern from the parents.
And so when you saw this child, or when you see any child, do you have specific training in the area of child abuse to alert you to different kinds of red flags that would cause you to report or follow up on something like that?
Sure, there's a whole fellowship that has 3 years of specific training for that, although in general pediatric residency, yes, we have lectures here and there, and an elective rotation for a month that was an option. I didn't actually do that elective myself, but certainly was trained in that as part of my general pediatric training.
And did you ever see anything in your care of Ethan Garcia that caused you to have concerns that the child was being physically abused?
Not physically abused, no.
What about physical neglect?
I've known that the family, and from my recollection, most of the visits, at least the well child visits, both parents would be present and always typically ask good questions and seem very reasonable. My last visit, though, clearly when I walked in, there was a tension in the room and discovered that the parents were divorcing at the time, and did not see any evidence of physical neglect, but there's certainly a significant change in the demeanor of both parents in respect to each other.
Now, did you ever meet an individual named Christopher Martins?
No, I didn't.
So the only people that ever came to the child's pediatric visits were the biological mother and biological father?
Right.
Now, going back to the physical neglect issue, I want to show you these growth charts. Is this a growth chart? This is the one that's for weight.
Yeah.
Could you take a look at that? Is that something that is unusual for a child of that age?
It certainly can be that it's shown that he's lost some weight since previous visits, and certainly can be a cause of neglect. A lot of times at 12 months, 15 months of age, motor skills are also advancing, and muscle metabolism is certainly advancing, and kids can certainly lean out. Their linear growth and their height is roughly the same as previous, and that's not too much of a concern. Certainly hindsight, that was an early sign possibly of some neglect, sure.
Okay. And the other two charts that I just handed you, do
Right.
those show more consistent growth?
Consistent
or-
growth, correct.
So if a child is continuing to grow in height, even though they're becoming more active, would you anticipate them?
At this age, yeah, especially breastfed kids, and I think he was mostly formula fed. And, this is something that we follow on a monthly basis, and if it's still, not picking up on the new curve, then, we would certainly look into that more medically as well as socially, and I just, didn't have an opportunity to do that after this particular visit.
When was the last time that you saw this child?
3/15 of 07.
And did you notice or document any bruising on the child at that time?
No, I did not notice any bruising, and I specifically looked for that because of the tension in the room. I had him in his diaper and looked underneath his diaper, and I did not note any physical harm.
Was there anything that you noted about the child at that visit that was worth putting in your records?
About the child in particular, the exam was pretty routine and appeared to be healthy in most respects, other than I wrote just that her parents are divorcing and mom and dad had differences regarding circumcision at the time. Mom wanted a circumcision and dad did not, and that was a very heated discussion at the time.
Now, was there any visit that was missed after 3/15 of 07?
After 3/15, any visit that was missed?
Yes.
No, he did not have any appointments after 3/15 of 07.
I want to show you what is a document that says Part B at the top, University of New Mexico Health Sciences Center, which is a part of the CART form, I believe. And I want you just to look at it and tell me if you recall seeing any of these marks that are noted on here on the child on 3/15/07.
I just thought that your name's card.
Yeah. This is actually not from 3/15/07 as you had mentioned.
No, it's not. I'm asking whether any of the marks that
Were
are on
present
this
on
diagram were present on 3/15/07.
Volume spot.
Had the mother ever talked to you about the child bruising easily or anything of that nature?
I don't believe so. No.
Now, 3/15/07, do you remember, in terms of his physical development, was he walking independently at that time? How do you note that in your records?
You know, there's a developmental questionnaire that we give to parents, and they had questioned yes, and I didn't mark anything different of the sort that would contradict what was marked by the parents.
Do you check to see if the child is actually walking?
Yes.
So
And
you would-
observe the child as the child is on the floor, walking from parent to parent, climbing up on the parent's lap.
Okay. Did you make any notations on that date of that nature?
Not specifically, but there was nothing that I noted that was not in conjunction when it was already checked up in here. in the
Okay.
development.
Okay, so I think I misunderstood your previous answer, which was you note these things, and that means you make a mental note of it,
Right.
and unless it conflicts with what the parents have told you, you don't
Right.
make a written note of it.
Right.
Okay. Was there any concern expressed about how the child had been falling a lot, or any bruising on the child that was explained to you during that visit?
No.
What about phone calls that you received from the mother? Were there any phone calls that you got where the question was, my child fell and has a bump on his head, what should I do? Something along those lines.
I don't believe so. Doesn't appear so.
When you said you knew the family, was that just from meeting with them here for visits, or did you know the family outside of the office?
No, just from here. The uncle, I think I had seen at church once or twice, but I'd never seen Ethan or his family at church.
And on which side of the family was that uncle? How did you know that was the uncle?
That was the referral. That's how Mom found out about me, because I had taken care of his son.
What about on the mom? Did you ever see any bruising on her?
No, not that I recall.
Can you generalize at all about calls from parents as the child gets older and develops? Do calls from parents tend to taper off if the child is generally healthy?
Yeah, that's a fair statement.
This child didn't have any, well, I noticed that he was lactose intolerant, so he was having soy products.
Mm-hmm.
Did he have any other kinds of issues that caused him to be extra fussy, hard to console, or anything of that nature?
No, I mean, I think he had the typical, ear infections and, respiratory infections that any child can have, but he didn't have any other medical diagnoses.
Nothing chronic?
No,
Did you ever treat him for broken bones of any kind?
no,
Any concerns for broken bones brought to your attention?
no.
If a child were, if you were contacted by a parent and told the child bruises all the time, or seems to bruise so easily, or they're worried about that, what would your advice be in that situation?
If they seem to be typical toddler bruises in the shin and the knees and those kind of areas, really most toddlers have. I might reassure them. If I get from the history from the parents that it's bruising in other areas, tummy in the back, any other place, that I may ask about family history. If all those were negative, I may do some blood work to look at that, to evaluate that concern a little bit.
What would the blood work be looking for?
Any kind of clotting disorder, platelets, or other specific deficiencies of things, as potency, that usually I might get a specialist to guide me with it.
Did you make any kind of referrals or order any tests of that nature or those natures regarding this patient?
No.
Can you think of anything else that happened or was brought to your attention during your care of this child that might seem important to mention now?
It really seemed like it was my impression with the visits, like I said, mother and the father would mostly come to the visits, would have, typical, decent, appropriate questions. I was very surprised at the last visit that I had with them, with the conflict that was clearly going on between them. And that was the first time that I'd ever seen anything difficult in their family as far as relationships between each other. So after that, I got a call from the sheriff's department.
And are you aware that it's not the biological father who's charged in the child's death?
Is that the Christopher Martin? I was told just from watching the news at the time that the suspect, I didn't know the name at the time until just I got this subpoena here.
So as far as your records reflect, this child was fine on March 15th of '07. And what the parents told you on that visit was that they were divorcing or they were divorced?
Divorcing. I don't think things were at the time set in stone or completed, but that is what they had told me.
And what was the visit right before that?
He had a sick visit 2 months prior, 1/11/07, with a colleague of mine. Like he had a little toe infection and a diaper rash.
What was the toe infection about?
Looks like it was the first toe, still a little cellulitis. He may have had a little ingrown toenail at the time. It was placed on antibiotics for concern.
Does it say in the record who brought the child?
Per mom, it looks like.
If Dad had been present but hadn't said anything, would that be noted in the chart?
It's something that you might be able to assume maybe that, it's tough to know, to be honest. That if Dad may have been there, he may not have been. It doesn't reflect in the chart.
Okay.
The information that was obtained, it appears to have been through mom, whether there was someone else present.
If you think of anything else that comes to mind between now and April 13th, if you wouldn't mind giving me a call and letting me know, and then I can pass that information along to the defense as well. Thank you very much for your time.
Here. Okay, I've got my recorder running, and Ann has her recorder running. And again, my name's Marie. Good morning.
Good morning.
And this is a pretrial interview in State versus Christopher Martins. Today is Wednesday, March 2nd, 2011. The time's about 8:15. And Dr. Coyle, you understand this interview is for the purpose of trial preparation and trial, correct? Okay. And I'm going to do my best to try and ask you as many questions as possible now. There's a chance I may ask Ann if we can reschedule, if I may have some more questions later, just because I'm a little short on time this morning.
Right.
But I understand that you were how would you describe your doctor-patient relationship with Ethan Garcia?
I was his primary care pediatrician.
Okay. And what would that entail generally? I realize this is a basic question, but what generally did you do as Ethan's primary care physician?
I would see him for his well checkups, at the typical times that's established by the American Academy of Pediatrics.
Okay.
After birth and for immunizations and shots. It's typically every 2 to 3 months in the first year and a half of life.
Okay. 2 to 3 months in the first year and a half of life is when you'd normally see an infant or a child?
Right, like the first visit is a newborn visit, and then after that it's a 2-week visit, 2 months, 4 months, 6 months. And then after that it's every 3 months until 18 months. 9, 12, 15, 18 months.
Okay. And just to jump ahead here, when was the last time that you saw Ethan Garcia?
The last time I saw him was March 15 of 2007.
Okay. And I understand I do have some of your records or most of your records and notes, so I apologize if some of these questions seem a little bit basic, but
It's okay.
how did Ethan appear to you at the last time that you saw him?
He appeared well. He was doing fine. There was certainly tension in the room from the parents' perspective, but he didn't have any. He was in his diaper there, as they usually are in the room. And he didn't appear to be particularly ill or sick or anything like that.
Okay. What about his size, his weight, and his length or height?
Yeah, his height it was growing pretty well. It's about between the 10th and the 25th percentile. Weight did take a drop, but a lot of times when they get to be crawling and then walking and then running around 9 to 15 months, oftentimes they do dip down a little bit just because muscle metabolism takes a lot of their calories. Linear growth is appropriate and not falling off. We don't wonder about any kind of organic or inorganic kinds of
Okay. When would you have expected to see Ethan again for a visit if everything else was fine, if he was healthy? Okay. Did Ethan get any shots during his last visit or immunizations the last time that you saw
he
him?
did.
Okay. What kind of shots did he receive?
He received one called Prevnar, another called Proquad, another called Haemophilus influenza type B, and the diphtheria, tetanus, pertussis.
And would you categorize these as standard shots, so to speak? Or
Yes.
Standard immunizations? Okay.
Yes.
What about any anemia? There's been some mention of some anemia, I think, when Ethan was first born or shortly thereafter. What is your medical opinion regarding Ethan and anemia or an anemic condition?
At the time, if it's a breastfed kid, that's something that we consider checking anemia between 9 and 12 months. He was taking whole milk and eating plenty of table foods upon report from the parents. And on exam, he didn't appear to be paleo or fatigued or anything like that would make me think of anemia. So I didn't think there was a reason to check that.
Okay. And what about, you said there was some tension in the room between the parents. Was this Juliana and who else was in the room then?
The biological father, I don't know the name, to be honest.
Okay. But the biological father?
Right.
Okay. Did you just sense tension, or was there a conversation?
I've known this family since he was born, and and I know some extended family. They had previously been appropriate, and they'd always come together, as far as I remember. Immediately when I walked in, it wasn't the usual, I could sense. And I think right off the bat, they informed me that they were divorcing, as I wrote in my note, and that there was, I guess at the time, some disagreement on whether or not Ethan should have a circumcision or not.
Okay. And was there any, did you counsel them at all, or did you provide them with any information regarding, stress in the home of the child?
Yeah, I think Mom wanted the circumcision and Dad did not. I informed them that there's no need for a circumcision at this time. If they agreed that they want one at this time, then that would be something that I'd have to refer to a urologist or a general surgeon, because I wouldn't be doing that in the office any longer. General pediatricians typically don't do circumcisions past 3 to 4 weeks
Sure.
Of age. After they get beyond 2 weeks of age, we generally don't like to do them in the office.
Okay. Were there any other issues that arose during this last visit on March 15th?
No, I mean, that was it. They informed me that they were divorcing. Didn't tell me anything more than that. The initial issue about the circumcision was the main thing. And then after that, I mean, they were appropriate. They were appropriate to him, to Ethan, both of them were. On my exam, I didn't notice any bruising or anything like that at that time. And he seemed to be doing fine. And upon both reports from both biological dad and mom, started to talk and understand phrases and climbing and running and walking and doing all the appropriate skills that he should be at 12, 13 months.
Okay. As far as Ethan's size, I know you said that he stopped gaining just weight then, as far versus height.
Right. He just had not gained much weight over the last couple months. His height maintained on a good velocity.
Okay. And you said that sometimes can happen when a baby starts to basically move around more on their own.
Right.
Creep and crawl and walk.
Right.
Okay. And I'm just not sure. I'm thinking do you have any specific questions right now? I'm thinking I might want to just ask for another telephonic on another date.
Right.
Just before I launch into anything else today.
Dr. Coyle, this is Ann Halter.
And tell me who you are, Ann, again.
I'm the prosecutor. I'm the one who came to your office once and we talked about Ethan.
Okay.
So I'm the one.
And who's the person that was interviewing me just now?
I'm the defense attorney.
Defense attorney for the...
Okay, what was your name again, ma'am?
My first name's Marie, M-A-R-I-E. Last name is Legrand, L-E-G-R-A-N-D. A-N-D.
Okay.
And Christopher Martins is the defendant in the case, who's accused of causing the child's death. I had asked you when we had met, and it's been quite a while, about whether anemia had ever been brought up as a concern by Juliana or anyone else in the family after the child's birth. Is that something that was ever brought to your attention or asked about?
I don't believe so. I don't think I have anything like that written in my notes. I don't have his newborn discharge summary here for my review. I think I saw him initially, maybe when I was still at Loveless at the time, and I think the first time I saw him here at my new place was when he was 2 months of age. So I think his newborn check and his 2-week check. I don't have my records to review here, but I don't recall him having any issues. Now I will say that on April 17, I have a lab with blood work here.
Was that April 17th of 07 or 06?
It is 06. So the first time, so on 4/14 of 06. Okay, so on 4/14 of 06, the first time that he was seen here at my new place, he came in for an eye discharge, and I did put in my notes there history of anemia at birth and was on iron supplementation immediately after birth, and has not been on iron supplements for 2 weeks, gaining weight well, eating and voting well. And on his exam, I noticed he had some eye infection, and I gave him some eye antibiotic ointment for that. And then actually I did order, I'm sorry, I didn't see this earlier, I did order a CBC to follow up on the anemia. And that was what the 4/17 of 06 was to follow up on the anemia and to see if he still needed the iron supplements because of his anemia that was discovered at birth. And at that time, his levels were in the appropriate range. His hematocrit level and all of his other indices, meaning the color and the size of his red blood cells, were in the appropriate range that showed that he did not have an anemia.
And I think you also told me the first time we spoke that no one had ever asked you any questions or asked for any advice about the child bruising easily or anything of that nature?
No, that was never a concern for the parents.
Okay, that's all I have for right now, and I understand that Ms. LeGrand has court at 8:30, and we didn't get started quite as early as we had hoped. So is it okay if we reschedule another time for some additional questions?
Absolutely, and I apologize for being late today.
That's okay.
That's okay.
It happens to
Yeah,
all of us.
Exactly.
All right, well, we'll let you
Appreciate
go.
your time today.
Thank you very much.
Okay.
All right.
Bye-bye.
Bye-bye.
Thanks. Okay, bye-bye.